All right, here we go with topic number 3, the top 10 critical and costly mistakes to avoid. Number 3 is choosing to only enroll in original Medicare without adding a supplemental insurance like a Medigap plan, also known as the Medicare Supplement Plan, or not enrolling in a Medicare Advantage plan, also known as Medicare Part C. Over 10% of Medicare beneficiaries today have elected to only enroll in original Medicare, A and B only. I think that majority of those Medicare beneficiaries don't understand or don't realize the financial cost that they could be imposing upon themselves with the gaps, major gaps to original Medicare coverage that we're going to cover right now. So if you take a look on your screen right now on the chart for Medicare Part A, you can see the gaps in coverage that you would have if you only had Medicare Parts A and Medicare Parts B. So with Medicare Part A, you have a deductible of $1,556 for your benefit period of days 1 through 60. Now, what happens if you go to the hospital 61 days later? That's a new benefit period that you're going to have to pay, and that means another $1,556 deductible. 61 days later or 90 days later, you go back to the hospital. Guess what? You will have another $1,556 deductible. So you can see that the gaps in coverage can cost you tens of thousands of dollars in out-of-pocket expenses. Now, if you're in the hospital days 61 to 90, you'll see your co-pays there, and that could take you up to another almost $12,000 in out-of-pocket expenses. If you're, God forbid, in the hospital from 91 to 150 days, you're going through your lifetime reserve days at $778 a day copay. That's going to cost you about another $47,000 in out-of-pocket expenses. So again, when I tell you there are major out-of-pocket expenses in original Medicare, you need to understand this. And this is the reason why you should have a supplement plan with your original Medicare, or maybe even consider a Medicare Advantage plan. Now, skilled nursing confinement, your first 20 days is no cost to you, but days 21 through 100, you'll have $194.50 copay per day, and now you're at another $15,560 in out-of-pocket expenses. Also, if you see that Medicare covers all of the hospice care, but very limited copayment for outpatient drugs and inpatient respite care. Blood, obviously Medicare covers 100% of the approved amount after the first 3 pints of blood. Now, take a look at the chart of Medicare Part B. We've gone through Part A, the hospital side. Now Part B is the medical insurance and physician services, outpatient care, tests and supplies. You will have an annual deductible of $233. That's for 2022. 2021, it was $203, so it has gone up $30 for 2022. So what happens is once you pay your $233 a year annual deductible on Medicare Part B, you will now be responsible for 20% of all Medicare approved costs, and Medicare will pay 80%. What Medicare does not cover is excess doctor charges. What are excess doctor charges? Quite frankly, an excess doctor charge is if you go to a doctor who accepts Medicare, but they do not accept Medicare assignment, they can charge you, depending on the state that you're in. Not all states do recognize excess doctor charges, but here in the state of Florida, where I live, there's 15% of excess doctor charges that a doctor can add above what Medicare allows. So again, that is totally on you, and there are Medicare supplement plans that will indeed cover your excess doctor charges. Also, clinical lab services, Medicare generally does cover 100% of that approved amount. Home health care is covered 100% of the approved amount, 80% for durable medical equipment. Medicare also will cover your outpatient hospital treatments, and blood, 80% of the approved amount after the first 3 pints of blood. So the point that I'm trying to make to you today for those of you, those 10% of Medicare beneficiaries who are on original Medicare alone, you really need to think about what you are going to do. It is not prudent most times, I'm not saying 100% of the time, but most times it is not prudent to remain on original Medicare A and B alone. Consider a Medicare supplement plan. We are going to talk more about Medicare supplement versus Medicare Advantage in one of our upcoming segments, so stay tuned.